Good morning.
Good morning, ma'am.
2 minutes wait करते, then we start the session. स्क्रीन दिख रही है सबको?
Yes, ma'am.
Okay. So last time हम लोगों ने tuberculosis का introduction पढ़ा था, types पढ़े थे, right? So what is exactly tuberculosis? Their definition. What is their type? Different type of the tuberculosis. Okay, ये सब हम लोगों ने देखा था with the risk factor. Correct? आवाज आ रही है ना मेरी properly? Hello.
Yes, ma'am.
Okay, good. So today's we are gonna learn about the pathophysiology and the diagnostic features, management, clinical features. Okay. So first of all, last time भी हम लोगों ने जो देखा था, so the latent tuberculosis is turning to the active tuberculosis. Okay. So what is latent tuberculosis? So latent tuberculosis, it lives in our body only, but it is asymptomatic. So it can't spread from one person to the another. Okay, but latent tuberculosis can turn into the active tuberculosis by any risk factor. Okay, so जो हम लोगों ने last time risk factor देखे थे, if you immunocompromised, old age patient, healthcare worker are the one of the risk factor, even a smoking patient or the tuberculosis patient. If you get infected with a tuberculosis patient, you get into the latent tuberculosis, into the active tuberculosis. Okay. and active tuberculosis can spread from one person to the another. Okay, so what is the pathophysiology of tuberculosis? How tuberculosis occur? So this is the basic tuberculosis. So as we all know, in tuberculosis, the immune system has been compromised. Okay, for example, AIDS or in a old age where aging has occurred, our immune system is all compromised. So, first of all, mycobacterium is mycobacterium tuberculosis is the aerobic bacteria. Okay, it need a oxygen. So generally, it is into the alveolar space. Okay, so from alveolar space, it can spread to the upper lobe. Okay, and it activate the memory T cells. Okay, macrophages they activate the memory T cells and they release the certain type of the immune system organism like the cytokines. Okay, and they causes a caseous necrosis. It lead to the cavitation and then it lead to the spread to the other organism. So primary, it occur the gone focus. If the gone focus with lymph node involvement, there is a gone complex. Okay, ये हम लोग डिटेल में देखेंगे, but just imagine, okay, these are the bacteria of Mycobacterium tuberculosis. Okay, so that Mycobacterium tuberculosis first involved into the alveolar space, and from alveolar space it spread to the other upper lobe of the lung, and then it can spread to the other lobe of the lung also. Okay, so what is gone focus? You can see gone focus like this in a caseous material. So it's a gray white form, solitary nodule that is hilar lymphadenopathy. Matted multiple lymph nodes also shows the gray white cut surface. Okay, these type of the gone focus you can able to see. So what happened when the droplet nuclei with the bacilla we inhaled, it entered the lung and deposit in the alveoli. Okay, but our macrophages and T lymphocytes, okay, they act and try to contain the infection by forming the granulomas. Okay, so inside the macrophages, the mycobacterium infection remains silent. Okay, they remain in a latent format. Okay, but in case if the weaker immunity system, if there is a patient of immunocompromise, if our immunity get decreased, wall of the macrophages loses its integrity and the bacilli are able to escape and spread to the alveoli to the other organ. So it's spread from alveoli to the upper lobe of the lung and the other part of the lung and the other part of the body. Okay, so I will go into the deep. So what happened first? When the mycobacterium infection occur, okay, it generally affect in the pulmonary alveoli. As say कि mycobacterium needs the oxygen, okay, and the gaseous oxygens occur in the alveoli only. So it affect primarily in the pulmonary alveoli. So three process occur, either elimination, retention, or active infection. So what is elimination? Elimination, macrophages engulf the bacteria and they eliminate the infection. Okay. Retention, the immune system suppress the infection but bacteria remain viable. We called as the latent tuberculosis. So mycobacterium remain in the macrophages but does not cause any type of the symptoms. So we called as the asymptomatic. Okay. And third is the active infection. Mycobacterium invade the immune response and separate the infection to the lung tissue. Okay. So active infection, if immunocompromise, as I earlier said, when immunocompromise occur, our immune system has decreased, it separate the infection in the lung tissue and form into the active infection. Okay, so after the active infection, if the active infection occur or if the retention occur, what happened? Immune system has loaded in, okay, alveolar macrophages. These are the macrophages, and if you see, these are the mycobacteria. So they engulf the mycobacteria. Okay, so they detect the presence of the pathogen and engulf the bacteria. So when mycobacterium inhibit the macrophages, phagosome plus lysosomes, normally it form the phagosome. Okay, so phagosome, it protect the inside the macrophages. Okay, but what happened in mycobacterium bacteria, that phagosomes are not formed. Generally phagosomes are the protected inside the macrophages, but in case of the mycobacterium, that phagosomes form ही नहीं होता है. Okay, therefore bacteria replicate inside the macrophages. Okay, and primary infection occur. So primary infection कब होता है, जब then phagosome बनता ही नहीं है because of the mycobacterium, and then bacteria replicate inside the macrophages only, and primary infection occur. After the 3 week, our cell mediated immunity get activated, and that surround the cell to form the granuloma. Okay, our mediated immunity activate हो जाती है. So activated means cytokines release होते हैं, interleukins release होते हैं, and they surround the cell to form the granulomatous tissue. So that granuloma tissue lead to the necrosis of the lung tissue at the infection site, which we called as the gone focus. Okay, so when that granuloma is surrounded by the necrotic tissue, we called as the gone focus. So consider mycobacterium tuberculosis, okay, engulfed by the macrophages, and macrophages surrounded by the granulomatous tissue. Okay, so that part is get necrosis and we termed as the gone focus. But when that gone focus involve the nearby lymph node to the infection, we termed as the gone complex. Okay, and then that gone complex gradually goes into the fibrosis and calcification of gone complex, and it involves nearby the lymph node, and then again causes the calcification, and then infection spread to the other part of the body. So in case active tuberculosis, you will able to see the fibrosis and the calcification. ये समझ में आ रहा है? समझ में आ रहा है सबको या नहीं? आवाज आ रही है मेरी?
Yes, ma'am.
ये समझ में आ रहा है?
Yes, ma'am.
Okay. So how infection spread, you all able to understand? Okay. So generally in tuberculosis, we able to see even in the X-ray or in a X-ray only radiography. So you able to see the calcification or the fibrosis tissue over the lung, generally in the alveoli, and then it can spread to the other part of the lung. Okay. So in other term, look, this is the infected host, okay, and this is the initial infection occur. So mycobacterium tuberculosis penetrate the lower part of the lung. They penetrate into the alveoli, okay. Alveolar macrophages engulf the mycobacterium tuberculosis. These are the mycobacterium tuberculosis, and they engulf. So they infected the macrophages, aggravate and attack the immune cell, and to form the granulomatous tissue. These are the granulomatous tissue. So necrotic cells, lymphocytes, neutrophils. Okay. So mature granuloma form the certain infection. So that these are the granuloma. Okay. Macrophages surrounded by the granuloma we called as the gone focus. Okay. Look, these are the gone focus. So mature granuloma forms contain the infection inside. Okay, so granuloma may eradicate the infection and become the calcified. So either they do the elimination or either they form into the only the latent format, यहीं पे ऐसे ही रहेंगे अपने lung में, or either they go into the active. So how they will go into the elimination? If our immune system is proper, they eliminate. Okay, they eradicate the infection and become the calcified. Okay, so no symptom. In a latent format, they remain like this only, but there is no any infection, no any symptoms. These there are the asymptomatic. But in case of our immunity has compromised, okay, so if the immunity is compromised, it activate the T cells and the B cells, then central cell of the necrosis form, and there is replication. So there is growth of the mycobacterium bacteria. Okay, and then they transferred to apex to the lung where the host immunity system drive lung matrix and they causes the destruction and the cavitation. So that causes the fibrosis and the calcification. Okay, so in the lower lobe they can spread to the upper lobe and they can spread to the other lung or the other part of the body. समझ में आया? किसी को कुछ कंफ्यूजन है पैथोफिजियोलॉजी में? सब लोग जगे हुए हैं ना?
Yes, ma'am.
Yes, ma'am.
Okay. So this is the main pathophysiology of Mycobacterium tuberculosis. Okay. So see, in this case also, when transmission occur, 95% of the cases primary infection occur. Okay. our our immunity is so strong कि वो अपने आप ही irradiate कर देती है. Okay, so when there is cell mediated immunity, there is CD4 cells and the TNFF and CD8 cells, and they eradicate the our mycobacterium tuberculosis. But if not, if the latent tuberculosis, 5 to 10%, if these type of the risk factor, any HIV infection, diabetes, genetic factor, immunocompromised, tobacco, alcohol consumption, or any air pollution, or you are affected by the any tuberculosis patient, it reactivate. 50% of the cases death occur, 95% of the cure occur, but again relapse has the more chances. So once you have got the TB, it chances you get again the certain type of the lung diseases, or you will get the only TB only. Okay, so it's the reactivation phase, and then it activates the tuberculosis. Active tuberculosis causes the cavitation, fibrosis, necrosis. Okay, and then again the cycles come. So you, if the cavitation and fibrosis occur, you can easily infected the other person. Okay, so transmission occur. Get that? So what are the different clinical symptoms? यहाँ तक किसी को confusion है?
No, ma'am.
Okay, बाकी किसी को कुछ confusion है? सो गए क्या सब? इतना बोर हो रहा है सेशन? हेलो,
Yes, ma'am.
समझ में आ रहा है या सो गए सब लोग?
मैम समझ में आ रहा है.
ओके, सो हम लोग आगे बढ़ते हैं. ओके, सो व्हाट आर द डिफरेंट क्लिनिकल फीचर्स? So pulmonary, when we call it as the pulmonary tuberculosis, okay, primary infection, 90% of the infection occur in the lung only. When pulmonary tuberculosis occur, the central appetite loss and the fatigue. Respiratory, you can see the coughing on blood, hemoptysis, chest pain, productive, prolonged cough, night sweat, even chills, fever. Weight loss is the main characteristic symptoms, okay, with low grade fever, night sweat, fatigue, coughing. Coughing is more than the 3 months, then the pallor and the night sweat. Okay, these are the main symptoms of the tuberculosis. So other symptoms you can also see the dyspnea, okay, continuously if there is a presence of bronchopneumonia, chest tightness, non-productive cough, mucopurulent sputum with blood. and the chest tightness. So extrapulmonary symptoms is depend on the which part of the tissue has get infected. If the extrapulmonary symptoms mean if the person's having the infection to the gastrointestinal symptoms, so patient may causes the pain at that region, diarrhea, or any type of the gastrointestinal symptoms. So like this. So see, so if there is pulmonary tuberculosis, you see prominent features of the productive curve, weight loss, okay, uh, weakness, fever, dry cough, night sweat. In the gastrointestinal symptoms, you can see other type of the symptoms like chest pain or diarrhea or pain at the abdominal region. Okay, so according symptoms in a extrapulmonary symptoms, you see the clinical features if the person is having another localized area infected. So what area infected person may see the symptoms like that only. Okay, these are the mainly the symptoms of the tuberculosis. So how you are able to diagnose the tuberculosis patient? So what are the different assessment and the diagnosis? So tuberculosis is a disease that is spread through the air from one person to the another. Generally, there are two kind of the tests that are used to determine if the person has infected. Tuberculosis test, direct test, or indirect test. Okay. Generally, tuberculosis test and the direct test, these are mainly the two which determine the person has infected with TB or the not. So who should get tested for the TB? So TB tests are generally not needed for the people with a low risk of the infection with TB bacteria. For example, in a home, if one person is get infected of the TB, it doesn't mean you get tested to the other home persons. Okay, if the immune system has good, we don't need to go for the test if there is no any symptoms. But certain people should be tested for the TB bacteria because they are more likely to get the TB disease, including people who have spent time with someone who has a TB disease, people with a HIV infection or other medical problem that weaken the immune system. People with a HIV infection or any other medical problem, and people who have a symptoms of the TB. So obviously those people have a symptoms of the TB, we are gonna test it for the TB. But even the people who have tested for the HIV, okay, these people should get tested for the TB. Okay, because there is higher chances when the person's having the HIV infection, TB occur. So important is the history collection. So in tuberculosis, the history collection is important. There are any risk factor, there are presence of HIV infection, or how's the immune person is immunity is good or person is immunocompromised. It's very important for the history collection. Then the physical examination. In the physical examination, you may see the clubbing of the finger or the toes. There is swollen or tender lymph node in the neck and the other area as lymph node involvement. Pleural effusion, you may or you may not be found. Okay. And the crackle sounds by auscultation, you able to found the unusual breath sound. Okay. Swollen liver, swollen lymph node, swollen spleen. These are mainly these can be or cannot be found in the physical examination. So there are the different diagnostic tests. Okay, we talked about the direct and the indirect taste and even the tuberculin taste, but there are different type of the taste. So first is the bacteriological taste, sputum culture taste, chest X-ray, nucleic acid amplification, tuberculin taste, and the PCR. Generally, nowadays we go for the sputum culture test, radiograph, and the tuberculin test. Okay, so if any persons comes to you, we first go by the sputum culture test and the tuberculin skin test. Tuberculosis skin test is also called as the PPD or also called as the Montauk's test. Okay, so we go into the detail. So first is what is bacteriological test. So in bacteriological sputum test, there are the two type of the stain used. First is the Zell-Nielsen stain. and another is the Ormeinstein, that is the fluorescence microscopy. So by the Zell-Nielsen stain, 3 morning succession mucopurulent sputum samples are needed to diagnose the pulmonary tuberculosis. Okay, so continuously 3 दिन तक morning में they collect the sample of any person, and then they see under the smear. Okay, so under the smear they can able to identify the Mycobacterium tuberculosis bacteria. The advantages of this sputum test: it's cheap, rapid, easily performed, and its high productive value. Specificity is 98%, so it gives the confirmed diagnosis of the whether the person's having a Mycobacterium tuberculosis or not. Disadvantages: it may contain sputum like 5,000 to 10,000 AFP per millimeter. Okay, and young children, elderly, and the HIV infection persons may not produce the cavities, and sputum contain the Mycobacterium. Okay, so these are the advantages of these sputum smears stained by the Zell-Nielsen, and these are the disadvantages. So how we interpret the sputum stain by Zell-Nielsen? According to WHO, more than 10 bacilli per field, it is presence. Presence meaning A plus plus plus, that is 3 grade. So from 1 to 10 bacilli per field, it is 2 grade. From 10 to 99 bacilli per 100 field, it is 1. So from 1 to 9 bacteria plus 100 field, we write down the number, so moderate, and no bacilli seen, we seem as a negative. Okay. Another test is detection by the AFB by the fluorochrome stain using the fluorescence microscopy. So the smear may be stained by the Oramin O dye. Okay, Oramin O dye is one of the smear. So in this method, the TB bacilli are stained the yellow-green dark background and easily visualized using the fluorescence microscopes. So they use the fluorescence microscope to visualize the Mycobacterium tuberculosis. So their advantages is it's more sensitive and the rapid test. Okay, it doesn't need a time. It's hazard of the diatoxicity. It's more expensive, and generally after the fluorescence microscopy you have to confirm by the Zell-Nielsen state. So see, these are the fluorescence microscopy where you can able to see the bacteria.
मैम
Hmm?
मैम फ्लोरेसेंट माइक्रोस्कोपी में भी स्पुटम ही लेंगे ना?
Yes, sputami.
और
These are
मैम वो
sputum.
फील्ड मतलब क्या हुआ? वो फील्ड था, उसका मतलब क्या एमएल ऐसा कुछ है क्या फील्ड का मतलब?
कहाँ पे फील्ड का?
ये जील निल्सन मेथड में ये फील्ड, हाँ
या फील्ड मतलब वन स्पुटम का जो हम लोग टेस्ट लेने वाले हैं उसमें कितने फील्ड रहने वाले हैं. So if 10 bacilli in a one field, जैसे वन स्पुटम लेते हैं, राइट? सो वी कलेक्टेड द 3 मॉर्निंग सक्सेसिव मुकोपुरुलन स्पुटम, राइट? सो वो जो फील्ड है, वो जो एक एरिया दिखता है, सो फॉर एग्जांपल दीज आर द फील्ड. सो ये दीज फील्ड में कितने बैक्टीरिया दिख रहे हैं, दैट वी काउंट.
ओके मैम, ओके, यस.
So in fluorescent microscopy you able to visualize these type of the mycobacteria. So another is the sputum culture test. Okay, sputum culture test में there are mainly 3 type of medium. So first is the Lovestin Gilson solid medium, so we call it as LJ. Intubation period, they need to 4 to 18 weeks. So for diagnostic purpose you have to wait for 4 to 18 weeks. Liquid medium, they take the intubation period of 8 to 14 days, and agar medium they take a days of 7 to 14 days. So it's very long time diagnostic for the tuberculosis. So nowadays we don't go by these 3 methods. Okay, in old age or previously when we don't know how to diagnose or how to go by any method, so we go by this sputum culture test. So that's why generally old age में सुना होगा कि पहले के टाइम पे दे टेक द पेशेंट इनटू द आइसोलेशन फॉर्मेट. अगर पेशेंट को सिम्टम्स है तो किसी भी सिम्टम्स, अगर प्रोडक्टिव कफ है या हेमोप्टासिस है, सो अलग रूम में रखते थे एंड दे गो बाय द स्पूटम कल्चर टेस्ट एंड दे वेट फॉर द till the 14 to 18th weeks. Okay, and they diagnose the patient as a tuberculosis. But nowadays it's like x-ray and the tuberculin test indicate the person's having a tuberculosis or not. So what is Lowiston Jensen solid medium? So when grows on the Algae medium, Mycobacterium tuberculosis appear as a brown granular colonies. Okay, so these type of the colonies form after the intubation of 14 to 18 weeks. So sometimes we called as the buff, rough, or the tough. So the medium must be incubated for a significant length of the time, usually 4 weeks, due to the slow dubbing time of the Mycobacterium tuberculosis. So Mycobacterium tuberculosis double or show in that medium after the 4 weeks. So it take a long time. Okay, but in this medium you see Mycobacterium tuberculosis like this format. Like these are the brownish granular colonies. Second is the liquid medium. So the most liquid medium used, these are type of the different liquid medium. Okay, so Dubose or the Middlebrook or Procor or the Bake, Sula or the Soutons. Okay, so in liquid medium the growth begins at the bottoms and creeps up and form the prominent pinnacle at the surface. So see, this is the bluish. Image में दिख रहा है? So these bluish particles are, जब यहाँ पे इंटुबेट करते हैं in liquid medium, so they take around 14 days, like 8 to 14 days, and here you can able to see the Mycobacterium tuberculosis. These are the liquid medium. Same occur in the agar medium. Okay, another test, diagnostic test, we go for the chest x-ray. So chest x-ray demonstrates the extensive patchy retinonodular opacity, particularly on the left peripheral at the junction of the mid-upper zones, or the parenchymal cavity can be identified. Here you can able to identify. In active tuberculosis, consolidation or cavitation, you can able to see infiltration, consolidation and the cavitation. So if person's having a proper history of HIV or history of any diseases which causes his immunity is decreased, and we see the in a chest x-ray there is infiltration, there is consolidation or the cavitation, you can able to diagnose the patient as a tuberculosis. Okay, fourth test, we do the nucleic acid amplification. Okay, generally we not doing right, अभी हम लोग ये टेस्ट करते ही नहीं है. Okay, so it take a several hours, specify identification, its low sensitivity and the high cost. Most useful for the rapid confirmation of the tuberculosis in persons with a AFB positive sputum. So utility is the AFB is negative pulmonary tuberculosis shows, or if there is extra pulmonary tuberculosis, where we do the nucleic acid amplification. And the tuberculin skin test. So it's very important to understand the tuberculin skin test is also called as the Montauk's test or the purified protein derivative. Okay, so what we do in this test, we inject the fluid into the skin of the lower arm. Okay, so we inject 0.1 ml of tuberculin PPD. PPD is the purified protein derivative. Okay, and after 48 to 72 hours, we check for the reaction and we diagnose the patient according to the size of the will. So see, these type of the small needle we used. Okay, and we insert 0.1 ml contain the 0.4 tuberculin PPD and it shows the reaction. So that needle goes under the subcutaneous tissue. Okay, so when they go into the subcutaneous tissue, there is shallow swelling on the skin surface. Okay, so if there is no induration, the test is negative. Okay, If there is induration, the test is positive. So what we do after the injection, अगर first day पे inject किया है, then we check after the 48 hours the size of the induration. Okay, so we actually see कितना size है induration का. Okay, if there is no induration, the test is negative, so patient is not having any mycobacterium tuberculosis. But if there is induration, we can diagnose the patient as the tuberculosis. So how we signified that, how we interpret that? So if the diameter of the induration, we check the diameter like this. Okay, so if the diameter of the induration is less than 6 mm, we interpret as the negative. Okay, if there is diameter of the 6 mm or greater but less than 15 mm, hypersensitivity of the tuberculin protein may be due to the previous TB infection, BCG, or exposure to the atypical mycobacterium. But if the infection is more than 50 mm, so strongly hypersensitive to tuberculin protein, okay, and suggestive of the TB infection or the disease. Even 6 mm, more than 6 mm, we diagnose the patient as the tuberculosis and we take a history that patient is previously infected or not. If the patient is previously infected, then also this test may be positive. Okay, and we generally go for the vaccination, so we give the proper vaccination as the BCG. वो हम लोग देखेंगे. ये समझ में आया ट्यूबरकुलिन टेस्ट?
Yes, ma'am.
Okay, so nowadays we first go by the chest X-ray and then we go for the tuberculin test. So in a 48 hours we able to diagnose the patient as the tuberculosis, so patient having a tuberculosis or not. Okay, third, we do the test of the polymerase chain reaction, PCR. So essentially what is PCR? PCR is a make of millions of identical copy of the specific DNA sequence, which may be a gene or a part of a gene or simply a stretch of the nucleoid with a known of DNA sequence. So its function of which may unknown the polymerase chain reaction. So they replicate the DNA sequence. So this PCR, that polymerase chain reaction, also called as a gene probe nucleic acid probes, it's which the polymerase enzyme are used to amplify. Okay, amplify means they make a many copies of the specific DNA or RNA sequence of the extracted from the mycobacterium cells. So these technique to make a many copies of the specific DNA region in vitro. So it it doesn't take many time, but also it take a 24 hour to 48 hours. It's a rapid procedure and it's high sensitivity. Okay, but generally we don't go for the PCR test. We generally go for the X-ray, go for the tuberculin test and the blood examination. यहाँ तक समझ में आया?
Yes, ma'am.
Yes, ma'am.
ओके, किसी को कुछ कंफ्यूजन? हेलो, किसी को कुछ कंफ्यूजन है यहाँ तक?
No, ma'am.
No, ma'am.
Okay. These are the different type of the taste we done generally. Okay, so remember the in exam you have to write about these all tests. Okay, but in a practical purpose you go by the chest X-ray and you go by the tuberculin skin test. Okay, so bacteriological test, sputum culture test, radiography, nucleic acid amplification, tuberculin skin test and the polymerase chain reaction. Okay, बाकी के जो कॉम्प्लिकेशंस है एंड मैनेजमेंट पार्ट है वो हम लोग कल देखेंगे. यहाँ तक किसी को कुछ कंफ्यूजन है? किसी को कुछ क्वेश्चन, कंफ्यूजन?
No, ma'am.
ओके, कल हम लोग इसके कॉम्प्लिकेशंस एंड द मैनेजमेंट पार्ट देखेंगे. ओके, इवन द preventive measure.